Are you over 70? Then listen closely. Doctors are now issuing a crucial warning. It might be time to stop certain routine medical tests you've been doing for years. More testing isn't always better, and after 70, some common screenings could actually do more harm than good. Stay with me to find out which ones. Reaching your 70 seconds, 80 seconds, and beyond is a significant milestone, often bringing wisdom, perspective, and perhaps more time for the things you enjoy. But it can also come with an increasing number of doctor visits, prescriptions, and tests. Colonoscopies, mammograms, PSA tests, bone density scans, endless blood work, the list can feel overwhelming. You diligently follow the guidelines, wanting to stay healthy, wanting to catch problems early, but have you ever felt tired of it all? Wondered if the discomfort, the anxiety, the cost, and the time spent on these tests are truly making a difference in how long or how well you live? You're not alone in feeling this way. In fact, the medical community itself is increasingly recognizing that the one-size-fits-all approach to screening needs a major adjustment for older adults. The mantra is shifting from more is always better to smarter, personalized care. Today, we're exploring why this shift is happening and which specific tests leading medical organizations and doctors are now advising you might be able to safely forgo after reaching a certain age. Why the change of heart? Why would a test recommended for decades suddenly become questionable after 70 or 75? It boils down to a fundamental principle. The balance between potential benefits and potential harms changes as we age. Think about screening tests. Their main goal is to detect a serious disease like cancer early, when treatment is more likely to be successful and extend your life significantly. However, several factors change this equation in older adults. Slower disease progression. Many conditions, including some cancers detected by screening, tend to grow much more slowly in older individuals. Finding a very slow-growing cancer might not actually change how long you live, especially if you have other more pressing health issues. Competing health risks. As we age, we often develop other chronic conditions: heart disease, diabetes, lung problems. These conditions might pose a greater threat to your lifespan and quality of life than a slow-growing cancer that screening might detect. Treating the conditions you already have often becomes the priority. Increased risk from testing and treatment. Invasive tests like colonoscopies carry higher risks of complications, like bleeding or perforation, in older, potentially frailer individuals. Furthermore, treatments for conditions found through screening, like surgery or radiation for some prostate cancers, can also have significant side effects that might be harder to tolerate and recover from in later life. The problem of overdiagnosis and false positives. Screening tests aren't perfect. They can sometimes identify abnormalities that look like disease, but would never actually cause harm or symptoms in your lifetime This can lead to unnecessary anxiety, further testing, and potentially harmful treatments. False positives, tests indicating disease when none exists, also cause significant worry and lead to more, often invasive, follow-up tests. Limited impact on lifespan. For screening to be truly beneficial, it needs to detect a disease early enough to allow treatment that extends your life meaningfully. If your remaining life expectancy is limited due to age or other health conditions, undergoing rigorous screening for a slow-developing disease might not provide that benefit, while still exposing you to the harms. It's this complex interplay of factors that leads experts to recommend reevaluating and often stopping certain screenings after a certain age threshold, typically between 70 and 85, depending on the test and individual health. Let's start with one of the most common and often dreaded screening tests: colonoscopy for colorectal cancer. For average-risk adults, screening is typically recommended starting at age 45 or 50 up to age 75. But what happens after 75? The influential U.S. Preventive Services Task Force, WESPSTF, states that for adults aged 76 to 85, the decision to screen for colorectal cancer should be individualized. This means it's no longer a routine recommendation for everyone. Why? Because the potential benefit of finding and treating polyps or early cancer in this age group becomes smaller, while the risks associated with the colonoscopy procedure itself, like bleeding, perforation, complications from sedation, increase with age and other health issues. For those over 85, routine screening is generally not recommended because the potential harms are likely to outweigh the potential benefits. So, if you're between 76 and 85, this is a prime example of where a shared decision-making conversation with your doctor is crucial. You need to discuss your personal health history, your previous screening results, Did you have polyps? Your family history, your overall health status, and your personal preferences and values. If you're very healthy and have a longer life expectancy, continuing screening might still be reasonable. But for many, especially those with significant other health problems, the potential downsides may start to outweigh the upsides. Less invasive stool-based tests might be an alternative to discuss, although their benefit also decreases with age. Next, let's discuss mammograms for breast cancer screening. Recommendations typically advise regular screening for women starting in their 40 seconds or 50 seconds. But again, the question arises, when is it reasonable to stop? Guideline opinions vary slightly, but the USPSTF recommends biennial, every 2 years, screening mammography for women aged 50 to 74 years. For women aged 75 and older, they conclude that the current evidence is insufficient to assess the balance of benefits and harms. This doesn't necessarily mean stop immediately at 75, but it signifies that the clear benefit seen in younger women becomes less certain. Why the uncertainty? Similar reasons, as with colon cancer screening, apply. Breast cancer diagnosed at older ages may be slower growing. Women aged 75 plus are more likely to have other health conditions that pose a greater risk to their lifespan. The potential harms, including false positives leading to anxiety and unnecessary biopsies, and overdiagnosis of cancers that might never have caused problems, become relatively more significant compared to the potential life-saving benefit, which diminishes as life expectancy decreases. Again, the decision for women 75 and older should be individualized. A conversation with your doctor, considering your overall health, life expectancy, personal history, previous breast cancer or high-risk lesions, and your values regarding screening is essential. Some organizations, like the American Cancer Society, suggest continuing as long as a woman is in good health and has a life expectancy of 10 years or more, highlighting the need for personalized discussion. Is this information helping clarify some confusing guidelines? If so, please tap the like button. It lets me know this type of content is valuable to you. For men, the PSA, prostate-specific antigen blood test for prostate cancer screening, has long been controversial, and its value becomes even more debated in older age groups. While guidelines vary, the USPSTF recommends that for men aged 55 to 69 years, the decision to undergo PSA screening should be an individual one based on discussion with their doctor, shared decision-making. However, for men aged 70 years and older, the USPSTF explicitly recommends against PSA-based screening for prostate cancer. Why such a strong recommendation against it? High rate of overdiagnosis. Autopsy studies show that a very high percentage of men in their 70 seconds and 80 seconds have prostate cancer cells that are extremely slow growing and would likely never have caused any symptoms or affected their lifespan. The PSA test often detects these insignificant cancers. Harms of treatment. Treating these slow-growing cancers, often involving surgery or radiation, carries significant risks of side effects like incontinence, urinary leakage, and erectile dysfunction, which can severely impact quality of life, especially in older men. Limited mortality benefit. For older men, particularly those with other health issues, treating screen-detected prostate cancer has shown very little, if any, benefit in terms of extending overall lifespan compared to watchful waiting or active surveillance for low-risk cancers. Essentially, for men 70 and older, the potential harms resulting from PSA screening, anxiety from high PSA, biopsies, side effects of treating insignificant cancers are generally considered to outweigh the very small chance of detecting a life-threatening cancer early enough to make a difference in overall survival. While exceptions might exist for extremely healthy older men with a long life expectancy and a strong family history, the general recommendation is clear. Routine PSA screening is likely not beneficial and potentially harmful after 70. Beyond the big three cancer screenings, there are other tests often reconsidered in older adults. Pap smears. Cervical cancer screening. For women who have had adequate prior screening with normal results, guidelines generally recommend stopping pap smears around age 65. The risk of developing significant cervical cancer after this age, especially with previous negative tests, is extremely low. Continuing screening offers minimal benefit and can lead to unnecessary procedures for age-related cervical changes that aren't cancerous. Women who have had a hysterectomy, removal of the cervix for non-cancerous reasons, generally don't need pap smears at all. Bone density scans, DEXA scans for osteoporosis. While screening for osteoporosis is important, particularly for women after menopause, the optimal frequency of repeat testing in older adults, for example, those over 75 or 80, is less clear. especially if initial scans were normal or only showed mild bone loss, osteopenia, and fracture risk is being managed through lifestyle or medication. Repeating scans too frequently often doesn't change management. This is another area for discussion with your doctor about whether repeat testing is necessary based on your individual risk profile and previous results. Routine blood work, for example. Cholesterol A1C. While monitoring existing conditions like diabetes, A1C, or managing cholesterol on statins remains crucial, the need for aggressive screening for high cholesterol in someone, say, over 80 with no history of heart disease, becomes less clear. The focus might shift more towards managing symptoms and overall function, rather than hitting specific numerical targets designed for younger populations. Again, it depends heavily on the individual's health status. The overarching theme is moving away from automatic age-based protocols towards a more goal-oriented and personalized approach. What are your health goals? What risks are you willing to take for a potential, but perhaps uncertain benefit? This brings us to the most critical point: shared decision-making. The guidelines and information we've discussed provide a framework, but they are not absolute rules carved in stone. Your health is unique. You have your own medical history, family history, lifestyle, values, and priorities. The best healthcare decisions, especially later in life, are made when you and your doctor work together as partners. Don't be afraid to ask questions. Why is this test being recommended for me now? What are the potential benefits specifically for someone my age and health status? What are the potential harms or downsides, including false positives, complications, anxiety, cost? What happens if we find something? How would it change my treatment or outcome? What happens if we don't do this test? Are there alternative ways to monitor this? A good doctor will welcome these questions and engage in a thoughtful discussion, respecting your preferences and helping you weigh the pros and cons in the context of your life. If a doctor dismisses your concerns or insists on tests without explaining the rationale clearly, you might consider seeking a second opinion, perhaps from a geriatrician who specializes in the care of older adults. Remember, it's your body and your health journey. Have you ever had a conversation with your doctor about whether a certain test was still necessary as you got older? How did it go? Share your experience or any questions you still have in the comments below. Your insights can be incredibly helpful to others navigating similar decisions. Let's quickly summarize the key points regarding tests often reconsidered after 70. Colorectal cancer screening, for example, colonoscopy. Individual decision between 76 to 85, generally not recommended after 85. Breast cancer screening, mammograms. Evidence insufficient after 75. Decision should be individualized based on health and life expectancy. Prostate cancer screening, PSA test, recommended against for men 70 and older due to high risk of overdiagnosis and harms of treatment outweighing benefits. Cervical cancer screening, pap smears, generally stopped around age 65 for women with adequate prior normal screening. Other tests, bone density, some blood work. Frequency and necessity depend heavily on individual health status and prior results. Core principle: the balance of benefits versus harms changes with age. Focus shifts towards individualized care, shared decision-making, and prioritizing quality of life. Aging well isn't just about adding years to your life, but adding life to your years. Part of that involves making wise healthcare choices, understanding that more isn't always better. Questioning routine tests after a certain age isn't about neglecting your health. It's about ensuring the care you receive is truly beneficial and aligns with your personal goals. Be informed, be proactive, and partner with your doctor to create a health plan that focuses on your well-being and quality of life above all else. If you found this discussion on navigating medical tests later in life helpful, please consider subscribing to our channel and hitting the notification bell for more evidence-based health guidance tailored for seniors. Your engagement helps us create more content that matters to you. Thank you for watching. Stay informed, stay empowered, and live well.